Uh, it's some 17 minutes after 7. You're still here on the AM Showtime now for my banner. A series of things happening in the health sector recently. We heard about Tamale Hospital, where a number of the theaters are not in operation. We also heard about a hospital that is having to charge extra for electricity because of the situation that we find ourselves in. Can you imagine the number of hospitals that we don't know yet who are charging extra because of the lack of power? Also, a lot of issues with regards NHI and some hospitals having to turn away patients who are using the card because the NHIA is not paying the health facilities. So we want to touch on a number of health issues this morning here on my banner. My guest is Mr. Gabriel Benako. He's national chairman of the Ghana Coalition of NGOs in Health. I want to say good morning to you. Thank you for your time.
Good morning.
So, you know, with all the things, because you are closer to the health facilities than all of us are,
Yeah.
you know first-hand information. Can we start with energy and how this is affecting the hospitals?
Okay, thank you. First of all, I would like to thank the Coalition of NGOs in Health. We have over 400 membership across the country, in all the 10 regions, and in every district, and almost every community. You can find our members working with Ghana Health Service and the Christian Health Association of Ghana, CHAC, to provide alternative support to government in health service delivery. And so we are much aware of the issue of health in the country. Now, with regards to the impact of the electricity or energy in the health service delivery in Ghana, I think it's one of the biggest challenge, not even businesses, because everybody needs some kind of health service delivery, and most health service delivery dwell much on electricity or light to be able to provide the needed kind of health services for people who need it, especially in the rural areas. Now, we are much aware that the health service delivery in the country has been affected greatly because of the inadequate power supply or energy. One, a lot of surgical operations have not been able to be performed because there's no light. Even where there are some complications, and we may want to draw your attention to some of the complications as a result of inadequate light. Doctors have to use the torchlight alone, which is not adequate, because the alternative light that will require by personnel or expert is the torchlight, but the real light is what we use every day, that we can see everything clear during operations and after operations. So that one is affected greatly. Two, especially the private health facilities have to charge extra for some of the services that they are rendering, because they have to buy diesel or petrol,
Yeah,
to be able to provide.
It's very expensive. You're running 24 hours continuous.
Exactly. So that we are also much aware that is affecting health service, and therefore it is likely that the ordinary Ghanaian that we have promulgated policies to protect the people who are supposed to enjoy universal access to health, we are denying them. And I think that, yes, a high time government look at the opportunities that civil society provide alternatively. I was expecting the Minister for Energy to create a dialogue platform for civil society to come and say, hey, just like we did for Senchi, we were thinking the minister plus the two ministers, health.
And health.
Yes.
I guess this one will be powered.
Yes, power and energy or whatever it is. But we are expecting these two ministers to have interministerial dialogue with civil society, because civil society have provided tremendous alternative support in the health sector. So what would you do, or what would you have done if you had been engaged? there's always solution when you dialogue. There are always solutions when you begin to appreciate the other side of the story, not that of political, but that of helpful engagement to come out with alternative. I'm aware, and every Ghanaian is aware, that once you are in government, you are supposed to provide universal services to Ghanaians or even foreigners. And therefore, the issue we are discussing is not political. And I think one of the things government is missing is they are not having the listening ears from civil society. And that is very dangerous. For every government that wants to perform very well, you need to create that conscious platform for civil society to provide you the best alternative of what they think, because we are always on the ground. Not even the government officials.
Is it because they have not engaged you, or perhaps they have, but they have not taken into consideration,
They have not consciously engaged us. If they did, we would have had solution to this energy crisis. Because one, government promulgated the policy of public-private partnership. This policy is huge. It creates a lot of tremendous opportunities for government to have engaged civil society to say that, what do you think about this energy crisis? Civil society are so connected that we can be able to provide the best alternative to begin to provide some step-by-step approach in solving this energy crisis. Yes, government have the responsibility to do a lot of infrastructure and investment engagement with development partners. But what the tricks that works in the community, we have the solutions. And we will be able to provide the needed solutions, especially in the rural areas, to allow government to be able to discharge its duty very well. That has not been done effectively. And we think that it's very unfortunate. The other aspect that I wanted to talk about seriously is, if you move to the district facility, they have been using their internal generated funds in every hospital, every health facility you go. They have some mechanism that they are able to use internal generated fund to be able to provide some kind of infrastructural services, provisions that can expand the health facility, that can provide extra services. Because of the doomsor, they have to use this money to engage in buying of fuel. And therefore, those infrastructure development are stalled. That is also a major impact. And so you get to a health facility, you see that they have started some projects internally, but it's been stalled because they have had to deal with energy crisis. And that alone, I think, government should be able to see the red signs that it's not the best for the country, and it's not the best, especially being a social democratic party whose ideal are supposed to be the best for the people, whose ideal is supposed to be the grassroots people's listener, whose ideal is supposed to be all-encompassed government. So we think that, yes, the president may have been brief about the plans ahead, but I think the plans have not been practical.
Is it justifiable, though, that those costs are passed on to the patients?
Yes, exactly. For example, if you get to a health facility, and I'm a direct witness to, 2 weeks ago, I was in the Brown Hafo, one of the districts, and there was an accident case. And the person who was supposed to be scanned to know whether he had some internal bleeding or this one. That day in that district, there was no light, and the hospital did not have enough fuel. And this was an accident case. This was at the emergency unit. So you can imagine that person could lose their life. So alternatively, I have to take the person in my car to the nearest CHAC facility for such a service to be performed. I was there. I was moving, and the incident happened, and being the national president for NGOs in health, some of my members called me that this is a civil society activist involved in this kind of thing. I picked the person myself with the help of a police officer. We moved. The health facility didn't want to even give a referral.
Why not?
Because they think that having not been able to scan the person, they still think that the person is okay, because they haven't seen any sign of complication internally.
But the person could be walking dead any minute.
The person was not even walking. He couldn't walk. So you can imagine how our health system begins to provide certain kind of
But we were
services.
told when the timetable came out the first time that health facilities were going to be exempted.
But this is not the reality. To be honest with you, this is not the reality. We think that's why I'm calling on the minister to intervene. They have the men all around. And I'm even taking this opportunity to call the BNI to begin to find out areas where there are life of whether health facility enjoy life.
In my community, no.
Yes.
The Asherman Community Hospital also go off, and it's a strict timetable. If we're 24 hours, we're 24 hours. Like this morning, we don't have light. So you realize that their generator has been running since yesterday.
And that even add more cost to the health service delivery. And we are having complications with the national health insurance. And that alone, we will talk about it later. But I think that already the national health insurance is having a lot of challenges that we are not able to do, especially the CHAC facilities are grappling with government in terms of payment, in terms of prompt.
So maybe we can go there right now. What is the problem? What is the problem? How does it work?
We need to bite and we need to act. The national health insurance, even though we claim that it's one of the best in the world, the Ghana...
Our national health insurance?
National health now. Yes, a lot of health policy makers, government officials have made such statements severally. But I'm challenging them as the national president of coalition of NGO in health that it is not. And we need to be real. The health system that we have in Ghana is enviable, but our systems and our leadership ought to think differently. They need to respond to what people say on the ground. It is a leadership crisis. That's what I always say. Because the issues that we are talking about are issues that we are all have contributed to, and yet we are not taking steps in addressing them. We have had a lot of pilots upon pilots. We say we are doing this, we want to test and see, and we do it, we learn from it, and we don't want to implement the outcome of pilot projects. And I think the leadership of the National Health Insurance need to engage more, need to create the opportunity for more people, and also they have the responsibility to make things happen in the district facilities.
So who do they go to for their monies? There was a call to the finance ministry, but I thought, why don't we, rather attack the NHIA? Are they not the persons who are directly supposed to pay?
I'm saying it's a leadership issue, not only the official of the National Health Insurance, but where do they get their money from? Even to the members of parliament, they are also to be blamed, because I know that there are budgetary allocations, and I know that there are administrative procedures that affect the processes of we getting the money into the ministry, and the ministry allowing this money to go into these service providers. The processes has been delaying. That is one. Two, there are also a lot of corruptions in the system. We have a lot of evidence of where some of the district managers have issues with double names or more than ghost names into claims. And that's why I said it's a leadership issue until the Minister of Finance, the Parliamentary Committee in Health begin to hit the nail on the leadership who are supposed to provide the direction, the flow of transfer into the appropriate agencies. We will be suffering.
Do you
all
see
the
them?
time.
Do you see them though hitting that nail?
I haven't seen them because when it is time for their own remuneration, they are quick to act. But when it's time for them to discharge that duty as a national responsible committee or agency, I have not seen that proactiveness. And I'm challenging them today that we want to see them approve the health sector budget, additional health sector budget that can actually solve this problem in the national health insurance. And in totality, we want to see that they are able to engage with the Minister for Power and the Minister of Energy, and then the health, to see that the health service delivery in Ghana is beginning to face a lot of challenges. What can they do with the power that they have to be able to allow this ministry and personnel to work effectively?
But this is sad, you know, because this is health we're talking about. When you are sick, when you fall ill, these are the facilities that are supposed to take care of you. They should be number one in everything.
We are not supposed to wait till we're sick before we begin to implement the policies that we have. That's why I first said, one, the leadership commitment in making sure that there's already a budgetary allocation in the health sector. We know how much go to the national health insurance. We know how much we have asked from development partners. We know how much we can internally generate in the country. And we know the mechanism on how these inflows and outflows should be. Why should we wait for a pressure to come elsewhere to direct us to do what we are supposed to do? That is a critical issue that we are talking about. Honestly, the health sector, we are not doing well. The actors in the health sector are not doing well because whatever we have planned for the year, we are not being able to discharge it as a people.
So you blame leadership because
it's a leadership. It's a leadership crisis. It's a serious leadership issue, and I'm challenging any minister or any subcommittee that thing that is not a leadership issue. We could discuss further. Civil society, we are ready to engage them to discuss the health sector challenges. Because I haven't worked with Ghana Health Service from the sub-district to the Director General. I know if our leadership are proactive, if they are able to commit the resources, if they are able to do it on timely, the people in Ghana Health Service will work. They will do all.
But you see, one of my challenges, you know, as a journalist, is that the Ghana Health Service doesn't even talk. So sometimes when these issues are coming up, you wouldn't hear their view on it.
Yes,
if people have to give pressure, then the Ghana Health Service also has some sort of responsibility. They all have to hit that same nail to get the needed response from whoever. But if they stay quiet, then, I mean, what's the point?
Yeah, first of all, you know, civil society, by our brand and by our mandate, we are supposed to influence government policy in the right direction, not just to kowtow to government on whatever they think they want to do. We are supposed to provide the best alternative solution to development issues. And we are also supposed to be a watchdog to government and its officials. Now, the Ghana Health Service will not talk because they are directly employee of government.
Yeah, so?
And therefore, whatever they say, they are cautious.
But
I believe if we have an official of the Ghana Health Service sitting here, he will want to even defend what I'm saying. And even the people out there, Ghana Health Service personnel out there, will want to defend what I'm saying because his job is at stake.
Why should it be so? I mean, I think that's why we're here.
We have to change that mentality of that I will be fired and therefore I will not talk, even if I see something wrong. The health sector, you know what? In the next 20 years, there's a research from the Harvard University. In the next 20 years, there will be three things that will be the global agenda. One will be health. Two, globalization, and 3, ICT. Now, Ghana stands tall in terms of these 3 thematic areas in the world to initiate policies to be able to deal with our health sector that can be able, using ICT. How can you go to a health facility and you can have a lot of challenges in even getting your history? You have to go through a lot
records.
of, yes, you have to get your records. ICT can do that quickly.
I was disappointed when I got to know the very first time that Kolebu, if you were to go to Kolebu at midday today, they cannot tell you the number of people who have entered OPD, for instance.
Yes.
It would take a lot to get that data, and that shouldn't be so.
Exactly. Let me give you a typical example. Last year, one of the civil society advocates in the Brown Hafo, Tishman to be specific, had a health problem, and he was referred to Sunyane. He got to Sunyane, and the specialist that was referred to Sunyane was already in Tishman. So you can imagine that. And now he has to come back to Teshima, and he could have died. This is a person who was seriously sick, and he needed that person, or he should be sent to Komfo-Anokye. So he has to make those inroads before he is able to meet the specialist. Then the specialist also referred him to Komfo-Anokye or Kolebu. It took him 23 days before he was able to see the specialist, because all the tests they did in Brown Hafo, the specialist have to go through another test. So if there was an ICT system, simply the history of that person with a code can just be given to Kolebu, and Kolebu can easily trace the history of how they have provided some kind of interventions to that person, and therefore they can just do some few confirmatory tests.
It would just be a continuation of the process and not start all over again.
We are talking about leadership, and we are talking about effectiveness. How can we perform if we are not effective? And of course, if you have leadership challenges. And Ghana Health Service need to come out from their shelf to say that because I'm a government official, even where we see best practices, we cannot advocate for. That is wrong. They have a lot of best practices. They have learned it from other countries. They are experts in other countries, and they are doing well. But when they come to Ghana, they fear to talk. They fear to advocate. But in developed countries, you have seen public officials being an advocate in their specific sector. And they do that with civil society to be able to influence a lot of health policies and service delivery. That is the kind of Ghanaian health worker we are looking for.
Let's talk about the Ashanti region, because we're told that the only regional medical store of the Ghana Health Service in the Ashanti region can no longer supply pharmaceutical products to public health facilities because of depleted stock. Obviously, because the central medical store was gutted by fire not too long ago. But didn't we see this coming? The media started talking about it, and they said they had 3 months stock. I remember that clearly. So why should we be suffering just a month or so afterwards?
Yes, I think, yes, we have been justified as a civil society. 3 weeks ago, we had a press conference of which your station came to cover. And what I said in the press statement was that even though government said they have made adequate contingency plan to be able to handle the situation within 3 months. And I challenge government that it is untrue.
But then again, the Ghana Health Service didn't talk because they are closer to the action.
Exactly. So I'm happy that this report has come. We are also coming to make our release from all the 10 regions. And in the next few days, you will hear from us. We are collecting data in district, regional facilities to show to government that what we said, we meant what we said. Now, the impact of this was very evident because already in the normal Ghana Health Service medical stores, at the national and the regional stores, are woefully inadequate. For example, I work in the field of mental health in all the 27 districts in Brown Hafo. And I know the kind of pains we go with the community psychiatric nurses to be able to get drugs for the mentally ill patient. Sometimes we have to fall on the private health facility, pharmacy shop to buy, to be able to respond. And this is a government or a minister coming without this information to say that it will not have impact. It is not true. That is one. Two, the normal malaria drugs that government procure and given to the region, they are always woefully inadequate at every point in time. So at that time when the incident happened, already we were experiencing some minimal shortages. So as somebody will say, how could you say that it will not have impact? I think government officials need to be very, very sincere with the people. That I will make this passionate appeal to the Minister of Health, that we should not play politics with our health. We should rather deploy a team of experts to be able to tackle the issues when they happen, rather than to begin to justify the alternative. I think it's very unfortunate. And civil society, we are watching, we are on the ground, we are providing alternative services, but we are also watching, and we will be able to use what is happening in a dialogue, in a form of dialogue. The other aspect I think we need to do with regards to this burning is there has been series of burning after the Central American storm.
Yeah.
We have incidents in Tamale, and even my regional team is working out with the Ghana Health Service. And the funny thing is, they are not even willing to engage civil society to discuss what happened and the burning took place.
Really?
Yes. And for over 2 weeks now, we've been trying to make a release on what happened and to provide alternative. We have not been able to meet the leadership. And I'm sitting here to tell the regional director of health service in the northern region, and then the pharmacy unit of the Tamale Teaching Hospital, that they owe us a responsibility to explain to us what happened and why are they not willing to engage the civil society in the region to begin to look at the
if
issue.
If they tell you what happened, what would you do?
Yes, one, it will help in policy formulation. You remember the Central Medical Store, one, there was an audit report that suggested that the place should be insured. It was never done. That is negligence. That alone is negligence. And we, in our president, we said government should interdict all those responsible for that. Two, there has been a best practice elsewhere. Where government properties are, we're supposed to have maximum security. Move around and see government property, especially facilities that have provided essential health services. Go to hospitals and you only have private security that are not armed, that are not protected, even themselves, let alone to protect others. And we need to have policy direction on how our security system in the health service sector should look like. And that's why I'm saying government need to engage civil society. We will provide all these alternatives for us to enforce, and it will make our health service very wonderful.
I want us to also briefly touch on this Tamale theater is not working. What do you know about the details of it? I mean, is it only air conditioning, or this is a whole general problem?
Common sense tells us that when the theater is not working, then the whole system is not working. That's what it means. If the theater, which is the number one in every health facility, the theater facilities are supposed to be on, is supposed to be responsive to any situation, any emergency or normal surgical situation. And we have the theater not working. So it obviously tells you that all is not well at the regional hospital. And I think the leadership must.
But then again, you're not getting any response from the regional health director, so you would not be able to give alternatives.
I hope he's listening, because I know Tamale joined.
We're loud and visible in
I was there
Tamale.
last week, and I saw how a lot of institutions.
Is it perhaps because the coalition is, your mouth is too big? If they told you anything, even in confidentiality, you would go out there and go and say it. I mean, you put it in the report and everybody would know.
No, we are very responsible civil society. We have provided a lot of interventions to help government, and we have built that trust. The issue is our leadership must be very proactive. There's nowhere in the world that you can go and government will not want to work with civil society, especially in the health sector. And I guess one of the major issues in the health sector is the minister not continuously holding health sector actors well. It's not the current minister, it's been there, the previous minister, whatever.
So send them a petition, send the presidency a petition or something.
Last 2 weeks, there was a media that interviewed me, and I made mention of it. When we were about to do it, we had wrong signal. And so we are still watching. But what we are saying is that we are over 400 NGOs, and this NGO, you could have at least 3 people working in one NGO, multiplied by 3 times 400.
That's a lot.
Over 1,200.
That's significant. You can't ignore.
And we have families who are affected by health services. And we are working in the communities where the community trusts we, the civil society, even more than health workers. In most cases, when you have a health worker and a civil society in a community, because of our scale of mobilization, because of our skill of providing adequate information, they tend to like us more than even the health worker. And therefore, government or Ghana Health Service have seen the need to collaborate with civil society in some of these social community mobilization interventions. What we are lacking is we don't want to hit the nail at the district level, at the regional level, and at the national level. We are playing around our health issues, and that is what we think that if government is listening, yes. If it's not listening, there's always a time for civil society to act appropriately. Yes.
All right. We'll see. I'm sure something will come up pretty shortly, and hopefully you get a call later today. Thank you for your time. Mr. Gabriel Benako is the national chairman of the Ghana Coalition of NGOs in Health. He's been my guest. We've been touching on a series of issues affecting the health sector. I hope that leadership is listening, really, because, per what he said, it's a leadership problem. If you look at the NHIS, if you look at the power situation, the fact that hospitals are having to charge extra because there is no power, I mean, everything boxed together will be right at the doorstep of leadership. And I think that the other thing we've gotten out of this discussion or this conversation is the fact that Ghana Health Service must speak. It is your responsibility to share the challenges that you're going through, so government will hear, and then the right thing will be done. Stay on, we've got one more thing before talk comes your way. You're still watching the AM show.